Welcome to the Path to Be Well podcast, a podcast about being well. I'm Doug Rawson. Join me, Mark Tremblay and Paul Glory each week as we answer your questions with the sole purpose of helping people who suffer from a chronic medical condition in considering the safe use of cannabis so you can have a better quality of life. In this podcast episode, Mark and Paul bring awareness to alternative treatments and therapies. Through a safety lens, examples of alternative and complementary care providers are discussed to incorporate into your treatment plan. Whether you're considering chiropractic, massage, Reiki, physiotherapy, traditional healers, or essential oils, a plan to include these services maximizes achieving your health goals. You can control what your future path looks like. Anything is possible. To learn more, visit our website at weedwell.co/CAM. We hope this episode will help you consider possible inclusions into your treatment plan. If you have a topic that you'd like covered in a future podcast episode, please leave a comment at weedwell.com. Now, let's join in on the conversation.
Hi, and welcome to our broadcast, The Path to Be Well, a knowledge and learning session. Just so you know, joining me today is my colleague, Paul, and you'll want to stay for this episode as he helps us bring clarity in regards to complementary and alternative therapy and medicines. So do stay tuned for that. To all our listeners, we're so happy that you have joined us. And please note that you can also subscribe on our YouTube channel or even find us at weedwell.live. Now, these sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity and help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do them and us a favor by sharing this event. My name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded that it just wasn't for me. I will admit I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Now, having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So as I've already indicated, my colleague Paul is joining me. So Paul, welcome.
Good morning, Mark. And thank you for that intro. I know you've been covering some of these topics during the week with our listeners and our viewers, and leading up to today. And so we'll probably touch on some of the things you've discussed already and go into further detail. Complementary and alternative medicines we find in our roadmap in the Be Well area. And Be Well is really signified by I have compared and contrasted my health with a better appreciation of the success gained. And the reason for that, Be Well is at the end when we wrap up and we're going to restart or renew our progress and our forward motion in our path to wellness. And it becomes difficult for some to appreciate the number of alternative therapies and treatments out there when they're just trying to deal with their, let's say, pain every single day and every single hour, when they're just trying to deal with the anxiety and trying to get it under control. And so we don't even talk about that at the start. We've really, in Be Clear, and we've touched on this lots of times, it's just got to focus on you. Take your health selfie. And so there's no sense talking about those extra things that are out there that can assist you until we're well down the path where we've gone through Be Aware, Be Informed, Be Progressing. And so this is why you find it in Be Well. And so for the manifesto, it kind of ties in. And this idea is I control what my future path looks like. Anything is possible. And that only really happens when you get a handle on things and kind of a starting point. Again, why complementary and alternative medicine fits in this category. But enough about that for now. We'll definitely delve into that a lot more. I thought, Mark, we could start in introducing Joe from podcast number 7, I believe, at podcast.weedwell.com. And Joe's story is going to highlight what and where complementary and alternative medicines might fit into a treatment plan long after the point of feeling unwell, which is what I just said in my intro. And from there, we'll start to define what each things are. But if you could share some of Joe's story, at least to the part where it fits in here.
Yes. Well, Paul, as you and I would know, every patient's story is remarkable. And for Joe, it's no different. And I do remember a comment in that interview by our colleague, Doug, saying, Joe, every time I hear your story, there's something else that I'm finding out about your journey. And it is quite the journey. And one of my comments to Joe was, as he was sharing his story, you'd almost get the impression that Joe was sharing the story of someone that he knew, because he was composed and just illustrating really how far he had come. And when you listen to his story, it was hard to match the story to the person we were talking to. So, we all applauded him for having gone through this. But to use some of his words, he was basically saying he went through 4 years of hell. His son had leukemia. A good, very close friend passed away unexpectedly. And for someone that was already struggling as a military veteran, that's kind of, the straw that broke the camel's back, if I can use that terminology. And his words was that he found himself in a real dark place. And he was at a crossroad in his life and had to make a choice and a decision. But he didn't seem to have the capacity to be able to do that. And someone close to him suggested maybe considering cannabis, which he did. And cannabis gave him a little bit of a nudge, if you like, a little bit of support, a little bit of motivation and stimulation to be able to continue, but also to explore complementary medicine. In this case here, that was counseling. And almost verbatim, Joe was saying that, yes, cannabis was a good tool in the toolbox to help him get there, but really the therapy was a combination of cannabis and therapy or counseling. He said one needed the other to get him to where he is today. So definitely the term complementary really complements itself in this example, Paul.
Absolutely. And so let's define it. Now, complementary and alternative medicines, you might find written as CAM, C-A-M, just as an acronym. But whether they're physical things like massage, Tai Chi, deep breathing exercises, yoga, whether they're more mineral and vitamin based or essential oil, we'll say odors, smells, tea based or whatever. It's stuff that you would not find from your family doctor. Your family doctor generally would not prescribe tea as an example. And so it's non-traditional. So if we use the term traditional Western medicine, stuff you would find from your general practitioner, that would be we'll say that type of medicine. Everything else kind of fits into that complementary and alternative medicine. And those are a number of things. And there's lots more that we can put in that list: chiropractic care, Reiki, what have you. But whether it's complementary or alternative, it fits in that list. Now, the definition of complementary and alternative is, how do you use that list or something from that list? And this is where they diverge. So complementary, as the name suggests, is as a complement to. And so when you're using complementary medicine, in Joe's case, the cannabis was used in complement with the therapy. And so both assisted each other. Okay. And if Joe had approached it from, I'm going to use the cannabis and not use the therapy, it would be alternative. So you're using it instead of. And that's where they diverge. So the list remains the same of those alternative medicines. It's just how it's used, in conjunction with traditional Western medicine or instead of traditional Western medicine. And so there it is defined. One's not better than the other. One's not right or wrong. It's just how you see you use it. Maybe those around you have used it before, and your experiences and biases and whatever will play into that. Now, having said all that, there is a good basis of information for some of those disciplines, we'll say, and there's, we'll say, less information out there for others. Now, this isn't a judgment call to this one's better than the other, because I'm not here to say that. We're all here to make our own decisions, but just understand the list of research on one discipline may differ from another. So before you even go into there, just have an idea that you need to get out there and do the research and figure out how it fits into your treatment plan. So when I give the whole list of these different things, chiropractic, essential oils, Reiki, and whatnot, you can understand why we don't introduce this and be clear. It would make the mind spin to some extent, insofar as, again, you're just trying to get your condition or conditions under control. Saying you can do this, or you can do this, or you can do deep breathing, or you can do yoga, it's just going to confuse the person, and where we just want them to spend the time to get an understanding and then things under control. And then now we can branch off into things that can help. That's complementary and alternative medicine defined.
And that is why, this is not addressed, at the latter, it is addressed at the latter stage, right? As opposed to the be clear stage, because it would be overwhelming, no different than Joe's story. That's exactly how he explained it. He couldn't even collect his thoughts to be able to think of counseling or being open to that. It was too early for him. So he needed, and I think he may use the term, like he needed a crutch to be able to get and move himself forward. And cannabis happened to be that. But we all know how, the outcome of that was the complementary therapy that he was taking along with cannabis is really, what got him to where he is today.
Hi, Doug here from Weedwell. I wanted to hop in here for a moment, as we're excited to share with you how we see our Facebook community grow every day. I want to extend a warm welcome to you in joining our community to get tips, tools, and resources while collaborating with others to support you on your health journey. Look for us at weedwell.group.
And so let's, because we are talking cannabis here, let's look at that, because cannabis truly is, at this point, it's changing a little, but it is a complementary therapy in that it is not across the board where you would go into your physician and say, I have pain, I have anxiety, I am experiencing depression, or what have you. And they would say, well, you need to take a strain of XYZ and that'll help fix you. We're still at the point in cannabis world, if you look at the mental health conditions, you're more likely to be prescribed an antidepressant before cannabis, okay? And so cannabis is fitting the complementary in that role, using the mental health issue. You're more likely to be prescribed an opioid or some derivative of than cannabis for pain. So cannabis right now is a complementary medicine. And so definitely we've seen stories where it can assist with conditions, and Joe's is an excellent example of that. Now, this isn't meant to be judgmental or anything like that. I think it's important to point out that more often than not, when we touch base with consumers later on in their journey on their path to be well, those that use cannabis in more a complementary fashion instead of an alternative fashion tend to have better results, where they're using it in addition to their physical therapy, their mental counseling therapy, or whatever, or current medications, even not dismissing those medications or stopping those medications, but they're using cannabis in addition to. I think it's fair to say, Mark, overall, we've seen patients are much more successful in using it in a complementary fashion than an alternative fashion. Would that be what you've seen as well?
I would totally agree with you, Paul. And it's a good clarification of that cannabis as a complementary for sure. And that leads into, in some cases, it could be a alternative. And we've heard people come to us where they want to solely rely on cannabis. And when the question is asked why that is, well, they would prefer to go with something that is natural. And to which we would typically respond, and we say, and we ask why, they're like, because it's safer. But, that's a term or something that is looked at that is not necessarily accurate as well. I mean, it could be hazardous to your health, as are many other natural therapies potentially could also be hazardous. So it's a term that is used frequently, maybe a little too loosely, and there needs to be some caution raised on that perhaps you can touch on, Paul.
So I'll go to the first point that you mentioned there first. And when I said we see more success with complementary, medication substitution is definitely alternative, right? And we do see success with that. So just because you do one doesn't mean the other, like it's not an either or. It totally can be a both. So that's a very fair, astute point, Mark. A medication substitution, we have seen lots of people successful with that. And that would be using cannabis in an alternative fashion instead of. But I wanted to, highlight that. That's a very good point. To the point of natural, and this is where people will gravitate towards complementary and alternative medicines to some degree. And the other part is usually negative outcomes to traditional treatments drive people that way as well. But to your point, natural does not necessarily mean safe. We've always talked about this in terms of cannabis, and it's come up in multiple episodes. And it's more from cannabis is reasonably safe on its own. It's the catch once it's introduced to the body. And so we've had episodes where we've talked about CBD and the effects it might have on blood thinners or cholesterol medications or specific medicines that are processed through one way in the liver. But we won't go too much into that. But once the CBD is in the body, then it does have the ability to interact, even though CBD on its own is safe. So the same thing as some of these other substances, supplements used as medicines, once they've entered the body, they may react with something else that you're taking. And it would be completely inadvertent. It's just something to be aware of. And so we always caution people, natural doesn't mean safe. So make sure you do your research on what it is that you're putting in your body. And if you can figure out, especially if you're on certain medications or supplements, over-the-counter stuff, whether there's a known reaction with A and B. And if there is that bad for me? Because then you might want to rethink whether or not you go down that route. So yes, just a cautionary statement. Natural does not mean safe.
Yeah, and it's one that needs to be addressed from time to time because it is a misconception that is out there. And then even with cannabis, I believe it was last week's episode where cannabis misuse, could lead to negative outcomes as well, right? So that's another example. Dependency on it can lead you to that as well. So we always want to, because it is really what we do, we want to inform our clients and our listeners the pros, but also the cons, and not make it sound like this is, the miracle thing and that there's no potential risks associated.
So here's an easier way, to piggyback off that. Here's an easier way to look at it. these things are extra tools in your toolbox. And so perhaps cannabis and your traditional therapies have got you to a certain place. These are all things now at your disposal in your Be Well area that may speak to you, may not. They may not have been possible 2 weeks ago, 2 months ago, 6 months ago, whatever, but they're there. They're tools that may work for you, may not. Just due diligence. Two more things to keep in mind. As you use some of these therapies and incorporate them into your treatment plan, you may find when we talk in terms of titration, you'll have to adjust your cannabis dosing that way. And it might be a little bit more, but sometimes it's even, you take a little bit less. And we look in the idea of pain and physiotherapy. And for someone who might have used cannabis to get to a level of pain where they could do the exercises, we've seen this happen lots of times. Well, the exercises then prove to be even more beneficial. You're able to strengthen muscles around, we'll say, that injured joint, as an example. And now the muscles help stabilize the joint. You feel less pain. You find you even need less cannabis than you were using. And so you might find that you need to adjust that way. But these are working together. They're working hand in hand now to your treatment, in this case, for the pain example. One thing to keep in mind with the alternative medicine is don't get tunnel vision and eliminate the idea that, going back to the natural idea, that certain treatments, while might be harmful, are proven to work. They might have side effects that you don't like, but they're proven to work. And you steer yourself clear of that, and you might be doing yourself a disservice, is all I want to say. So some things that they definite scientific evidence to back up as a treatment, they may come with some side effects that people don't like, and then they find themselves, I want something instead of this. And it could be detrimental to your health. So just something to keep in mind. Certainly, I say that as no judgment to something that you're looking at right now. We just want to give people all the information and all the thoughts that should be going through their mind as they explore this area of medicine.
Yeah, very well, Paul. Paul, I wanted to just elaborate a little bit more. You just recently touched on this a little, but in the case of complementary and specifically right now, physiotherapy, that cannabis, by reducing inflammation and mitigating the pain level and allowing you to have mobility, has gotten you to the level now where you could introduce physiotherapy. And as you mentioned, there's a lot of benefits from that, right? Increasing your muscle mass, increasing mobility, that sort of thing. But as you are going through that exercise, exerting energy through it, you're increasing blood flow into your body, into your system, into your brain. If you're doing walks outside, the fresh air, the people that you meet and wave at, it goes well beyond just the physical aspect, although you are doing it for that reason. But let's not forget that, if you've been suffering from this chronic pain for quite some time, there's the physical, but there's other aspects, the emotional and the mental aspects that are targeted as well. So by being able to do that, for the reasons I just mentioned, it's helping in those areas as well. The fresh air, the sunlight, if it happens to be a sunny day, of course, and that you are outdoors, but they all stimulate and help you get closer to the state of wellness that would have ideally been a goal for you initially when you started your therapy. So that's why I always like to really emphasize that towards the end, because it should have been your goal from the beginning to be able to get to that. And when you introduce it, you're going to see benefits or responses that you have not been able to see for quite some time. So that to me gets me really excited. And I think that's pretty obvious because it's truly a significant milestone, to say the least.
That's an excellent point, Mark. We talk about it in the negative sense, peeling back the layers of the onion and how pain might contribute to your depression or your anxiety or how you're feeling. And it's nice to hear you describe it in the opposite manner. And less pain can contribute to a more sunnier, we'll say, disposition and getting out there and a better mood and feeling better. And it's just a matter sometimes of just stopping that cycle and kind of beginning to reverse it. And whether it's one small win or one big win, just to reverse that and getting out, like you said. And I appreciate that you put that in a positive spin, because we usually look at it in the opposite way, how things circle in a negative sense, but they definitely can circle in a positive sense and help propel you forward.
Yeah. And we've used examples that, different ailments will compound on each other. So lack of sleep, and then the next day you're tired. There might be a sense of depression. You're not thinking clearly, and it just compounds on each other because you didn't have a good night's sleep. So the opposite here, and I know I'm repeating myself, but I think it's worthy of, the opposite here is that you're outdoors, you have fresh air coming in, and the sunlight and everything that I've said about already. But this would build you up emotionally and say, wow, look where I've been. And yeah, that's a nice state to be at. And if you're not quite there yet, something to strive for. So encouraging words here to help you, to encourage you to strive for that, because it is achievable. And you mentioned that in the manifesto already.
Okay. I want to leave it here because leave it on an upbeat note, but perhaps I'll just wrap up quickly and we'll call it a day. Complementary and alternative medicines. So stuff it's treatments, therapies that are outside of, we'll say, traditional Western medicine. So what you would see from your general practitioner or maybe your specialist. Now, the difference between complementary and alternative is strictly on how they're used. Complementary used in addition to, and alternative used instead of. And there's no right or wrong answer for how you may use it. We've seen lots of success when used complementary, and we shared Joe's story to kind of highlight how he used cannabis in a complementary sense to other therapies and was successful. But we do see people using cannabis specifically alternatively to, we'll say, pharmaceuticals and stuff like that. No matter what you gravitate towards or use it as complementary alternative, just do your research, figure out how it will fit into your treatment plan. This is all part of your path to wellness, but figure out how it fits in there and make sure that it's not going to act or react with some things. We're talking right now specific to medications and other things that you're taking right now, where it would cause a detrimental effect or a negative effect.
Yeah, very well, Paul. So, Paul, if our listeners were looking for additional information, some resources that would kind of, fit in well with this, where should they go?
Honestly, complementary and alternative medicines are pretty easy to find right in Google. You can use that. Honestly, the stuff that you've been sharing all week in your broadcasts would have information on how to use them. I know you've talked specifically in terms of sleep and CPAP and things like that, and that'll speak to some people. There's lots of information out there. Again, treat it as another tool in the toolbox. If something interests you or someone talks to you as a friend and this worked for them, just do your research, do your due diligence type thing and go from there.
Very good, Paul. Also, too, as a reminder to our listeners, and you've heard me say this all week, many resources can be found on our weedwell.tips. Weedwell.tips. There's great resources there. I do encourage you to have a look there, as well as today's episode will be posted middle of next week. And you could find that at podcast.weedwell.com. So that's podcast.weedwell.com. In addition to this one here, you will find a library of all of our podcasts, including the one that we shared briefly today, and that was Joe's story, and he's podcast number 7. So in that series of podcasts, you will find all of our client interviews, hearing them share their story, some of which might really resonate with you or for a loved one. And in addition to that, any of our knowledge and learning sessions like this one here today from the previous months would be found in there. So I encourage you to go there. So Paul, nice having you again today, and good job on this topic. as I now proceed with my disclosure, rather. So to all our listeners, I'd like to remind our audience that these information sessions are indeed intended for individuals who are in general good health, are generally well-adjusted, are functioning effectively, and are not in need of medical treatment, including mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, for counseling, for psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of medical professionals. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak with your healthcare provider about the appropriateness of cannabis as a treatment option. And for those who have been taking some steps in improving your quality of life, congratulations. And remember, your journey is your journey. And as long as you're taking some steps forward in improving your quality of life, you should be proud of the progress that you're making. At WeedWell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. On behalf of Paul and myself and the team behind the scenes, we look forward to the next time that you join us. And until then, be well.
Thanks for joining us this week on the Path to Be Well podcast, a podcast about being well. Make sure to visit our website at weedwell.com, where you can subscribe to our show so you never miss an episode. While you're at it, if you found value in this week's show, we'd appreciate you sharing this podcast or leaving a comment or rating. We look forward to you joining us next time. Until then, be well.